Welcome to Collegial Conversations with Diana Clark, the professional webinar series that offers clinical and personal perspectives on issues that are common, but often not talked about. Here is today's Collegial Conversation.
Thank you for joining a Collegial Conversation with Diana Clark. Today, joining Diana is Dr. Matthew Koury. Dr. Koury is the founder and director of the Mind Health Institute in Newport Beach and is a board-certified child, adolescent, and adult psychiatrist. Diana and Dr. Koury will be discussing medication management within all stages of life and how medications can play a crucial role in one's physiology. Thank you so much, Dr. Koury, for joining us. I'm going to pass the conversation to Diana.
Thank you, Laura, and thank you for joining me today, Dr. Koury. I am fascinated by the subject of medications and what seems to be our current state of psychiatry about prescribing, but what is the best recipe for anybody getting care from a psychiatrist? I'll start with that tough question. What's the recipe? Yeah.
You know, I do think first and foremost, and it's like any relationships, it's built on trust, is you have to find someone you trust. And, you know, I've experienced that in my own life when I've had to find an accountant or an attorney or something outside of my realm of knowledge. And finding someone that you trust is imperative because in general, if it's within their expertise area, they're considering all kinds of factors that you don't even know they're considering. And if they don't communicate them to you, you don't know. And so I really do feel that really is at the core of any relationship, including one with a mental health provider.
Right. Thank you. I think trust and relationship, we play, for the audience who doesn't know this, we play a song before we start to get us geared up. And one of the songs was Huey Lewis's I Want a New Drug. And the line in there is one that makes me feel like I feel when I'm with you. That seems like a really important song line because I think that is what people are seeking when they get on medication. What are they actually seeking?
Yeah, no, that's a good point. And actually, I was at a baseball game yesterday, and a friend showed me this. I don't know if it's a meme. I'm always confused what that concept is, but it was some concept of, well, I need to drink my coffee, take my Adderall, do all kinds of things in the morning in order to feel alive. It's
right.
Kind of like almost made me cringe because usually how we like to view mental health issues or mental illnesses is these are issues that get in the way of our functioning. So if, say, depressive symptoms congeal into something that starts getting in the way of your daily functioning. And really what we're trying to do with medications is contain that so that you can still function at your best. We're not trying to seek some higher level of feeling or some euphoria. Like I think some people have that concept because that's what illicit drugs do, right?
Right.
These are not.
Yeah, people who have done illicit drugs equate euphoria with happiness and well-being when they're very different.
Very different. And that's not our goal, is this like constant state of euphoria. I work a lot with ADHD, and I hear a lot of my young people I take care of say to me, oh, I can't feel it. And I'm like, well, you're not necessarily supposed to feel it as long as you're focusing better and it's me containing the symptoms that get in the way of your functioning. That's our goal, not necessarily feeling that you took it in the morning.
Right.
And so I do think that's a misconception.
Can I interrupt you for 1 second? Sure. If in fact you're feeling the stimulant to an extreme degree, does that mean you probably shouldn't be on the stimulant, or is that diagnostically not true anymore?
You know, that's a good question because that is something you used to hear. I don't personally, from my personal experience, view it as diagnostically true anymore. Now it is true that some people take a stimulant and they feel like you flipped a switch, and that has some diagnostic value. However, I because so many people misuse these medications, that and they do. Young people in college tend to tell you they do help them focus, even if they don't have ADHD. Then I don't think that's necessarily true. One other thing, I prefer to call these medications not drugs, even though even so, just
Okay, they
because.
are medications.
But
I'm
I do
sorry.
think that when we talk about them like that, that really, when you say drugs, which again isn't totally inaccurate, it kind of blurs the lines between these medications and illicit drugs.
I agree. I agree. Thank you for that. So some of you know who have heard me talk before, but I have a dad who struggled with bipolar disorder and did not go on medication for many, many years due to stigma. And then became a very different man once he finally did. What is your experience with somebody struggling with a major mental health disorder and stigma and medications? What are you encountering?
I generally focus on, I try to tell people when they come to see me, is it is not. My role is to educate you about what your options are and educate you about, I almost said medicate you, which was a Freudian slip.
Right. Right.
My goal is to educate you about what your options are so that I can help you make an informed decision, and collaboratively decide what's in your best interest. Bipolar is a unique disorder because it is one of our issues that really medications generally need to be part of the equation if that diagnosis is accurate. And so there are times when we have to take a little bit more of a maternalistic role and help people come to that decision because of acuity of symptoms or safety factors. And so there are times we're a little bit more proactive about encouraging medications, but in general, I feel like my role as a psychiatrist is to first and foremost educate someone so that they can make a decision that's consistent with their own philosophies and ethics and feelings about these things.
So do you treat people who are medication resistant? And
absolutely,
what are some other strategies you tend to use? Let's take an adolescent with ADHD whose parents want him on a stimulant and he doesn't want to be on that stimulant, makes him feel anxious or edgy. Or what are the other strategies you would encourage in those situations?
Again, I always fall back as my primary is to educate. And I can't tell you how many times in my career I get a middle school student doesn't want to be on medications. We discuss that. We discuss the risk, benefits, side effects, alternatives of on. We discuss the risk, benefits, alternatives of being off. They decide that they don't want to continue with the medication and then come back to me 3-4 years later when they're in high school or college and what they're struggling with is getting in the way more, and they've progressed to being a little bit more of a situation. I don't want to say high stakes, but high school does matter more to most people than middle school does. And so that happens all the time. So I generally personally like to focus on educating them. I like to make sure they know what their alternatives are. I like to educate them about the science behind the alternatives. So sometimes the science behind psychotherapy is quite strong. Sometimes it's a little thinner. When
Can you give me an example of where psychotherapy tends to be a really valuable strategy?
Yeah, and this is generally part of the educational process for most things. I usually say, hey, someone who's dealing with mild to moderate depression or anxiety, it's not really getting in the way of their life, but they know it's there. We generally start with lifestyle changes and getting enough sleep and exercise. Once it crosses that line into more of that kind of moderate range, that's when we think psychotherapy is more useful. And then once it's getting in the way of life or psychotherapy hasn't worked, that's when we start considering medication. So for depression and anxiety, really we see psychotherapy as being the first line treatment most of the time. Whereas with ADHD, and this is part of the challenge with ADHD, is our science behind psychotherapeutic, behavioral, psychosocial interventions is just thinner, and medications tend to have a really strong evidence base. And so I generally like to let people know that's why it feels like the field leans towards medications more. I still don't love that that's the case. And there are times when therapy is more appropriate, but it really just depends on the diagnosis and what our science behind that shows, which is always evolving as well.
Are you using some of the newer, it's probably not new anymore, the genomic testing to figure out which medications seem to be most effective?
We do it sparingly. We offer it. I try to educate people about when it's appropriate.
Educate me?
It is a technology or a option that we have that's not completely out there. There is science behind it. However, it is not the end all be all yet. And so a lot of folks are presenting it as, I look at your liver profile and I can tell what medication works best for you. And that, from my perspective, is a little bit of an overstatement. It does give us some information about the profile of how our liver metabolizes medications. However, that is not the only factor in how our brain responds to medications. And so, again, it can be useful in the right situation, but it's not something that we generally do for everyone. And so that's again where you need to make sure you trust your provider and that they're knowledgeable about this and that you can have this discussion. And then, to be honest with you, if people really want to do it, I'm kind of more inclined to do it. Part of it comes down to just, we view a lot through the lens in our field of risks versus benefits. And there's no risk other than the expense of it. And so sometimes if someone's going to get a really hefty bill from doing this and it's not going to help inform our treatment decisions, the risks probably outweigh the benefits. But there are times that people want to do it irregardless, and there's no, other than the financial piece of it, there's no significant risk to it.
Are you finding yourself excited by some of the new research in new ketamine and psilocybin and some of the other more out there antidepressant strategies?
Yeah, I do feel like I always would love to have more treatment options in whatever it is we are providing. And I tell people all the time, not always to go back to ADHD, but I would love if we had great options that weren't medications. And I do think ketamine and psilocybin possibly have some utility in the depression realm. That's where they're being studied mostly. And I generally refer to specialists if necessary. There are a handful of specialists around here that this is really most of what they do. They're kind of interested in those depression when our standard treatments don't work. And I just think that those folks, because they are a little bit on the cutting edge of our science, the folks that are just doing that consistently tend to know the most about it. And fortunately, we have some good options around where I practice.
Mm-hmm. That is,
so
I just keep, I know enough about it to be dangerous. So I keep reading the studies, and it's interesting.
we don't, in our practice, don't offer it just because it is really kind of, I tend to be a little bit of a conservative view of the scientific literature.
Yeah.
And so it's a little bit on the cutting edge, but as you know, science and knowledge progresses over time. And so that's not to say it will be in 5 years. And hopefully then we have other novel options as well.
I know when my father was struggling with a major depressive episode, that medication wasn't touching anymore.
Yeah.
We really looked at ECT, ketamine, and it was good that there was a choice that there hadn't been 20 years ago.
Absolutely. And I certainly have a handful of folks I work with that medications didn't seem to do much. And ketamine has been the only thing that has led to any improvement.
Right.
Now, everything's not all better, but it's better than before.
Yeah, no magic wands.
Yeah.
So I'm going to ask you a personal question. When you think of the books that have come out in recent years about mental health and well-being and neuroscience and all of those that are accessible to all of us reading, do you have book recommendations that you give?
Gosh.
I know, that's a hard one.
It's funny, and it's probably a reflection of I tend to work with the younger side of the age population. There is a great behavioral strategy book we love, and I probably recommend several times a week. It's based on what's called parent management training, which is a behavioral strategy that helps for ADHD, but at the everyday parenting toolkit, I recommend for parents a lot. It's written by a psychologist with the last name of Kasdan, and it tends to be very user-friendly and reminds parents of the power of appropriate positive reinforcement structure, things of that nature. And I think it's just the age and stage of life I'm at as well, as you just see it all over the place with teachers and coaches. And you're just like, gosh, I wish they had some psychological mindedness.
I know. Do you find yourself getting a little bit sensitive to the amount of overpraising that's going on with kids and adolescents? Because I'm not sure it's good for them. Yeah.
You know what? That's an interesting question, because I do agree, but I also, and maybe it's just where I live and practice, I guess what I have a lot more concern about is what I see just in schools and coaches is preferential treatment, and kids who get preferentially treated that don't earn it, and that it demotivates them in the long term. And that
entitlement.
Yeah. So, I see that all over the place.
Me too. I mean, if we think of entitlement as defined as expecting, receiving from the world or teachers or an organization without any corollary obligation or responsibility on your part to meet midway, that's an entitled position.
It is. And I see that. I mean, and again, maybe that's based on I grew up in the Midwest. I live in Southern California, very different environments. But I see that as being pretty, I don't know, I'm very sensitive about noticing that and see it all over the place.
So you're living in an area California is interesting in its parenting. It's not like the Northeast, where if you don't go to Yale or Harvard, you've basically been a failure.
Right.
But there is the parenting Olympics going on in Southern California just as much. Do you ever find yourself coaching parents with kids who have ADHD to just say, you know, they may have a different trajectory. The trajectory you had planned for them may not fit. Do you ever find yourself in that conversation?
Yeah, you know, I do. I think of it though a little differently, and
Okay.
I try to, and I really do feel this, and I'm not going to use any names of schools because I don't mean to overly elevate her, but I tend to think of it personally. I would rather my kids like high school and be happy and go to a solid state school than absolutely hate it, not like school, and go to an Ivy League school.
Agreed.
I really would.
I would
feel like no doubt in my mind that maximizes the chance they like school, they find something they're interested. Those of us who go through a lot of extended schooling, like, would I have ever gone to medical school and do a master's degree I didn't need to do if I found high school like over 9 out of 10 aversive? I just don't feel like I would have. And so I try to educate folks about the options. There really are a lot of good colleges out there, and that we've got to sometimes step back and let our kids develop. One of the moms I work with told me, it's like, Dr. Koury, it's like a flower. They all bloom at different times.
Oh, that's lovely.
And I tend to view it more through that lens, and kind of keep it into context. I do also live in an area where a lot of the most successful people didn't go to Ivy League schools, and sometimes didn't go to college or went to community college. And so it's a little bit easier because people see folks around here who are entrepreneurs and business owners and are successful in a range of areas that aren't necessarily directly correlated with where they went to college.
Thank goodness. Thank goodness. I was reading a book called The Self-Driven Child by Strixhud, and he talks about the idea that our limited vision of what will create a successful adult is just limited. It isn't true. It isn't factually based.
That's kind of a cool concept. That's true.
Yeah. Yeah. It's a false assumption.
Right.
So, anything else that I didn't ask you, that I didn't probe today, that you would like our audience to know?
No, not necessarily. Not necessarily. I do tell people a lot, like, gosh, if you can find a good mental health professional to help you in your along your journey, that tends to be invaluable. Someone you trust, because it is best, as you know, it's best. People get the best care when they're consistent, right? And I use a lot of analogies for that. It's sometimes more consistency, and it's a journey, right? And I see a lot of people who get fairly poor care that are jumping around to different providers a lot. And
Looking for the magic bullet.
Right. I
Yeah.
think that is in some ways what they feel like they're looking for. And it's just not how it works. And sometimes I may make a decision and it works, and someone interprets that as, oh my gosh, must be the best psychiatrist out there. And that's not necessarily true, right?
It was a good fit. We do talk about fit.
Right.
Yeah.
So I tend to try to encourage people to find someone they trust, whether it's me or someone else, and be as consistent as they can.
Love it. Well, thank you, Dr. Koury. I appreciate it.
Thank you for joining this webinar. Tune in to more webinars and sign up for our newsletter at o'connorpg.com.